It is a difficult time for all of us, but we thought it was important today to reflect on the past of where we have been during this pandemic, but also talk about the present and future. So let me start with a little bit on the past for our conversation this afternoon, and particularly around this first graph, not to go through the details, but as you can see, almost a 300% increase in cases in the last 3 weeks in Lancaster County. Much higher than where we were in the April and May timeframe to the left of this slide. And if you follow that light green line for the county, you can see where we are at almost 400,000 cases per 100,000 as of last Monday. Let's remind everybody of the community commitment that we have had in responding to this pandemic. And I wanted to outline 6 items that we've done so far since we started really planning this work in January of 2020. It seems like many years at this point. I'll talk about the healthcare strategies that we put in place early on, our public health leadership on testing and contact tracing for the county, supporting our unique communities, our post-acute partners, as well as our employers and the school districts. So I'll start with our work around mitigation strategies. We did start this work probably with Dr. Contra's leadership and a small team in January of this past year. And it was really predicated on the framework from the Centers for Disease Control around limiting people entering the system, limiting exposures once in the system, and of course, reducing demand on our scarce resources. So I thought it'd be important to remember a few things that we did there, like shifting our workforce to remote. In order to work every day. Almost 1,200 were shifted to remote work. We talked about self-quarantining for travel. We put things in place like our testing centers, visitation policies, and used telehealth as opportunities to really limit those who would need our services and then try to provide those during the early months of the pandemic. Second, around limiting exposures once in the system. Really critically important as I'm wearing face masks, and we're reminded that it is the most important infection control measure we can do to limit exposure, to wash our hands and socially distanced. But also we did frequent deep cleaning of our areas across the system according to guidelines, and obviously protecting our staff and employees with personal protective equipment. We reconfigured spaces to allow for social distancing in our facilities. We put symptom screening in place at our front entrances, and we created dedicated COVID-19 units for care of those patients. And then finally, reducing demand on our scarce resources. Medical supplies, pharmaceutical supplies, critically important for us. And we put plans in place early on so that when the pandemic waned a little bit a few months ago, we continued to buy our full allocation from the vendors in order to have the supplies to continue our care for patients in the community. It's critically important for us to maintain both those PPE supplies as well as pharmaceuticals so we can continue the treatment. Next, responding to the pandemic. Obviously, you saw visual indications of that with our 10 testing sites, with our outreach from the community, with connections and coordination in terms of educational materials and outreach on Zoom, as we've all learned and seen over time. So we set up those tents at the PA College, remember, and also at Clipper Magazine Stadium. We followed that effort by really starting a community-wide tracing and testing effort with Lancaster Health Center and WellSpan Ephrata. That gave us a real comprehensive, unprecedented public health effort to really respond to the first wave. And I think the lessons we learned during that first wave are really helping us as we prepare and really address this third wave we're facing now. This is a reminder about contact tracing. We've been able to really exceed benchmarks up until the last several weeks in terms of reaching out to those cases. And I just met with our contact tracing and case investigating team this afternoon at lunchtime, really expressing my gratitude for all the work that they're doing and really stepping up with additional hours overtime to keep up with the surge of cases that we've had in the last several weeks. So I appreciate all of their help as we continue to address the work across the county. We were supporting unique communities during this beginning months. We took a population health approach. That's the same approach we take if we're going to care for our diabetic patients, our patients with heart failure. Patients with COVID-19 not only have short-term needs that may progress to hospitalization, but as we're realizing and seeing in the news, patients with COVID-19 will have long-term effects potentially as well. And it's critically important for us to use those same tools we use today to care for our heart failure patients and our diabetics that we would care longitudinally for patients who have had COVID-19. With Dr. Fife's leadership on the Lancaster City Board of Health and our thanks to the Mayor's office, we were really able to do some outreach to the city as well as our further communities in the periphery of the county with the parochial center and the work with Dr. Rehart, Dr. Martin, and Alice Yoder with our Amish Safety Committee as well. Another big piece is around post-acute care and supporting our post-acute partners. Penn Medicine partnered with Temple to participate in a state grant program called the Regional Response Health Collaborative Program. And this RICP program really enabled us to provide that clinical support and counsel to more than 80 skilled nursing facilities representing almost over 2,000 residents that we're taking care of. And this team, while small and mighty in Lancaster County, has been able to do some amazing things, like 24-hour call center access, rapid response teams. In fact, several of our team members responded to one facility and were able to work overnight shifts in that facility to make sure that the care that was needed during an outbreak was provided to those residents and the staff who work in that facility. We've been able to help with instruction around COVID testing, infection control, personal protective equipment, and as well as having specialty physician access to our infection control team, our geriatricians. And finally, and maybe most importantly, it's staff and resident morale support and grief counseling for those that have passed. We also have been able to support the employers in the community. With our work around the HealthWorks team, we've been able to kick COVID together by putting tools and resources in place to protect our workers, decrease stress, and build resilience. You can see some of the work that they put together in terms of educational handouts and outreach to our business leaders. And then finally, our support to the school districts. My personal appreciation to Dr. Jeff Martin, our Chair of Family and Community Medicine, for all the work he's been doing on the webinars, support for the school district superintendents in support with Alice Yoder and her team and the community health team. We've been doing many things in terms of research-based guidance, as you can see on this slide, as well as expert advice on demand. Dr. Martin's constantly taking calls and questions from all the communities and school districts. We're supporting them with webinars. We've been able to support some of the school district board members as well with information on how to approach our current surge. It's been an amazing opportunity to see the collaboration and coordination occur across all of our county in all of these areas, whether it's post-acute, our employers, as well as our school districts.